I'm Dr. Jerry Kaplan, Outpatient Medical Director at Gaylord Specialty Healthcare. Gaylord has been involved with COVID since the onset of the disease in the United States. Many patients came to Gaylord Hospital from acute care hospitals severely ill and had prolonged inpatient stays. Gaylord's outpatient COVID recovery and rehabilitation services started after we heard from our patients who had been inpatients that they were still having residual symptoms. Many patients got home and were still feeling tired, weak, lack of energy, exercise intolerance, and issues of shortness of breath. We also heard that they were having other symptoms, cognitive difficulties, what's currently referred to now as brain fog. Some people were having swallowing and speech difficulties from being on a ventilator for a long time. Other patients had visual difficulties. Gaylord's outpatient COVID recovery and rehabilitation services have been designed for anyone who has residual symptoms from COVID. Whether you were critically ill in the intensive care unit or had a relatively mild form of COVID that's just impacting your daily activities, we have the program for you. Once you come to Gaylord, the medical team at Gaylord will do a comprehensive assessment. You'll see a physician who will interview you, do a physical examination, review all of your records, and determine a customized program for you. Patients may have residual shortness of breath and wheezing when they're doing activities. Those patients work with our pulmonary rehabilitation program to work on breathing exercises, lung capacity exercises, conditioning programs. Many patients who have had other prior pulmonary issues, asthma, chronic obstructive pulmonary disease called COPD, are at higher risk for long-term symptoms from COVID and are very appropriate for our pulmonary rehabilitation program. I've also worked with many people who are professionals in the field and came down with COVID from their work environment. Doctors, nurses, respiratory therapists, and those individuals often have challenges getting back into the workforce. Some of them may even have psychological issues, so we have counseling available at Gaylord for any difficulties in terms of getting back into the workforce. We can also identify secondary issues that patients have and refer them out to an appropriate specialist like a cardiologist or a pulmonologist if needed. If you'd like more information about Gaylord programs and services related to COVID, please call our outpatient medical department at 203-284-2845, or you can look at the Gaylord website, gaylord.org/COVID.